Chamge chitap kalenjin ago itagat in tetutap Health Watch kaina nyungo Karen Chepkoech ago raini kingololi ak Dr. Elizabeth Mwachiro ole mwawech agoba seriatap kinaik anan breast cancer ak ole imuchi iye self breast examination imiga.
Screening for breast cancer involves three things. There is a self breast examination, an annual clinical breast examination, and then there's the mammogram or ultrasound depending on your age. So we're going to demonstrate how to do a self breast examination. A self breast examination basically is you as the person or individual doing a breast examination on yourself. There are two main aspects of the self breast examination. One involves you inspecting, which is looking for any abnormality, and then you feeling, what we call palpating, for any unusual breast lumps. So we'll start with the initial inspection. But if I go back a bit, I would want to insist on each person or individual picking a particular time. If you're female, preferably after your menses, when your breasts are less tender or sensitive. That's usually around the first week, 7 days or 10 days after your last menses. Preferably at a time when you're less stressed, either in the evening while taking a shower or early in the morning and you have no emergencies that you want to go and do. You can do your breast examination in the shower room or in the bedroom. The inspection will involve you looking at the mirror, looking at yourself in front of a mirror. So we have a mirror with us today, and I'm going to take you through the examination. So first undress to the top half, and then stand in front of the mirror. Hands akimbo, try and contract your pectoralis muscles, and with that motion, if there's any fixation of your breast to the chest, then it tends to move up. If there's no motion, then you're otherwise okay. Then the last motion, or the last thing that you can do while looking at yourself, is press on the nipple areola complex region and check to see if there's any discharge on either of the two breasts. So one side and then both sides. And you'd want to check if the discharge is clear or bloody, or if there's any form of greenish discharge. And this can vary, so it's important to know if you're just delivered, there will be some milk. But if you're otherwise a lady who's not at her post-pregnancy period, you should have no discharge. Second part of the self-breast examination would involve you examining yourself either when you're lying down or in the shower. Some people prefer the shower because it's a relaxed state. There is soapy water which allows better motion of your hands. So, and then you can do the self-breast examination while lying down. So before you lie down, get a pillow. If you're examining the right breast, then it would be preferable to put the right hand behind your head. Yeah, so we'll assume there's a hand over here. Place it behind the head and a pillow under your shoulder. That way you have exposed the axilla, which we'll talk about, because there's some breast tissue that extends to the axilla region, which is right below the shoulder, the armpit area, and you can examine that area. The other reason is because we have what we call nodes, which when you have breast cancer, there might be invasion of those nodes with the breast cancer. So lying down flat, hand on the side to be examined at the back of your head. I prefer or would advise that you start with the tail region, which is under your armpit, first before you go to the entire breast. So at the tail, you're using the 3 middle fingers and you're using the pad of your fingers to apply pressure. So you can apply either minimal pressure soft enough to feel for any bumps. You're looking for any bumps. You're looking for any abnormal lumpy tissue. And with the time, every month as you do your self-breast examination, you get to know and understand what your normal breast tissue is. So starting at the armpit area, you will use your left hand if it's the right breast, and the right hand if it's the left breast. So using the pads of your 3 fingers, feel at the axilla region. Under the armpit, you want to feel the inner aspect, which is where the curve of your ribs are coming in. You want to feel the roof of that armpit, and I'll show you, we can examine the outer aspect of your hand, which also might have lymph nodes. So it's as a more sensation or palpation while putting pressure, and you make small rotatory movements towards the outer circumference of your breast. Then when you get to the breast, you can either use 2 methods. There's an up and down method. I'll take you through it, or there's a rotatory method, whichever you find comfortable. So the up and down method would start right below your clavicle bone. You make small rotatory motions all the way from below the clavicle, the collarbone, to under the breast. And then once you get under the breast region, now move up gradually, slowly, small rotatory motions all the way to the collarbone, and then keep moving laterally next to your last side of feeling, and then downwards. So it's an up, if we could draw, up and down motion to cover the entire breast. The circular motion would imagine your breast as a clock. So all you're doing is making the same rotatory motions with the middle fingers, the pad of your middle 3 fingers, around the entire breast, going all the way from the outer circumference of the breast to the region just below the collarbone, and then start drawing to the inner aspect of the breast until you're able to cover to the nipple areolar complex, which is that darker region at the nipple area. You want to finish off by expressing using your thumb and your index finger to see if there's any abnormal discharge. And then do the same on the other side. So if it's the left side, place your left hand behind the head, a pillow below your shoulder. You will use your right hand, start at the armpit, the axilla region, feel to the chest wall, which is the medial aspect, at the roof, which we call the apex, and on the lateral aspect, and then using either the up and down motion or the circular motion, palpate the entire breast. With time, if you gradually do this and create a fashion, you'll be able to customize your own self-breast examination. So that's in summary how you do a self-breast examination. Yes.
Kamwa Dr. Elizabeth Mwachiro gole tinye biik chechang serionoton baginai kamun mosiche konyoiset eng kasarta nemagat.
So breast cancer, the reason why we're having very many people present late and we have poorer outcomes in Africa, East Africa, and in Africa in general, and even in the States or in more developed countries, the African Americans, as opposed to, the Asians or the whites, have a poorer outcome or higher mortality rate and morbidity, mortality meaning death rate, because they either present late, they present at a advanced stage, they don't seek treatment early, and in places where they offer trials, the trials are, they give different regimens so that we can find out which is the best cure. There are never people who bring themselves out to get tried with different chemotherapy drugs. So I think more and more as a country, we want to raise awareness about breast cancer and cancer in general. and that if you come early, and you make a diagnosis early, it is treatable, it is curable. You follow up, you can live a long life, and we can just, break that C word, that cancer word that stigmatizes people. So in general, most of the people who come with breast cancer, worst case scenario, you find ladies who come with wounds, that have eaten up most of their chest, or they come with this lump that was there for many years, a year or two, and now it's become big. So while they would have had a breast conserving surgery, now they end up having a whole mastectomy, and they basically feel that there is no hope in life, yet there is.
Kamwa inendet kole inomen oretab korotik anan lymph node serianaton. Choton je ikose yon kiyoe self breast examination.
So the nodes, so we all have lymph nodes in our body, and there are different lymph node stations. We call them stations in different parts of the body. For breast cancer, the first part, or the one that people tend to notice early, are the nodes under the armpit, what we call the axillary nodes. That's almost the station or the place where the cancerous cells will tend to go. And once they get there, they have access to invade other parts of the body, the blood system. So it's more, if you ever have a sore throat or a child gets a small infection, what you tend to feel under the jaws. So they are lumpy, they are rubbery, but when they become cancerous and you feel them under the armpits, they tend to be large or even small, but they don't move as much. So they might be fixed to the chest wall. Most of the time, if you feel a breast lump, so a lump in the breast tissue itself, and feel a node in the armpits, then that's concerning. But do not make an assumption. Go and get seen and let the doctors investigate you before you make an assumption that you have advanced disease. You can also have enlarged nodes when you have an infection, or if you're breastfeeding, you get an breast engorgement, and there's overflow, you tend to feel like you have enlarged lymph nodes. So it's good to examine yourself all the way to the armpit to get a complete picture, but then after that, go and get a clinical exam, and then we can do other tests, and which will give us a better diagnosis of your underlying condition. So if you have, in the event of an underlying cancer, it does not disappear. So that lymph node or that node, let's call it a node, will be present throughout. It might be attached. You don't see any changes, but with time it might be, instead of just feeling the one that you felt initially, they might end up becoming two or more, and you can't define them, so they are stuck to each other. But that's more advanced. If you ever feel an initial one and you're concerned, come as soon as possible. Do not wait for it to progress. And other places that you might have nodes are above the clavicle, on the same side. Sometimes you can have on the opposite side, but that's different. Breast cancer, there are different types and different stages, so that would be dependent on where you are.
Kates Dr. Elizabeth Kole, pururutek chemangu enginaik ko engasarwek alak komabunu serianaton. Noton kobo kamanutiet neo keker kanyoindet yon miten pururutek.
Breast discharges or nipple discharges that should be worrisome to you is if it's one-sided, if it comes out in itself, so you're not expressing, you've changed your bra, or if you've noticed a stain on the bra, or if it's a man, a vest. If it's bloody, so bloody nipple discharge would be concerning. Other types of discharges that you could have that are probably hormonal are a watery discharge. If it's a lactating mother, milky discharge. If it's a lady who's about the menopausal region, perimenopausal or postmenopausal, greenish discharge. But any discharge should be concerning to a person. But we're not saying that all the discharges are cancerous. We're saying that if you see any discharge, It's one-sided, it's spontaneous, there might be pain or there's an associated lump and probably lumpy, then please seek medical attention.
Agot ganda naat missing seriatab kinaik konome kwonyik koimuche kosich murenik serianaton agot icheket.
Breast cancer, primarily or overally, will be more common in the females than the male. So 1% of all breast cancers would be male breast cancers, and then the rest, a huge percentage, female breast cancer. The female is exposed to more hormonal exposure, estrogen state, than the man. So while we both have breast tissue, the male breast tissue is immature, but the female starts developing right when you're pubertal. It starts changing, then your hormones, there's a cycle that you normally go through monthly. So an estrogen exposed state keeps on changing the breast cells. Then you get pregnant, or if you don't get pregnant, you are in this state where you have a continuous exposure of estrogen. And we can look at that in the causes. A prolonged exposure of estrogen in itself is a risk factor, not definitive, but one of the risk factors to getting breast cancer. So women will have a higher risk of breast cancer than the males. So globally, 1% of all breast cancers will be male, and then the rest will be females, will have a higher rate of getting breast cancer. In Bomet, there isn't a specific number. I would say most patients present late. Most patients have either been seen peripherally and sent home or treated because they thought it was an infection, and when they present when it's pretty advanced. By and large, we're just trying to demystify or sensitize women to come early, and also with the insurance, health insurance, we're trying to make them know that they can be treated. Most people fear the cost surrounding treatment of breast cancer, and they start thinking, oh, I'm going to die, but if you presented early, you'll probably be treated and will be cured. I can tell you there are many patients who get stigmatized at home because they have these fungating, foul-smelling ulcers on their chest wall, and they get put in a room and they don't get any treatment. But when they come to hospital, we can give them palliative care. So there's hope. There's always hope for palliative care. But better yet, you can come early and get cure.
Asimatis serianiton kokamwa Dr. Elizabeth kole nyolu keam amitwogik cheititaat ak keam mazoezi en kila. Kandan miten tuguk cheu kenyisiekab chi chemakimuche keter.
So there are things that you can prevent and there are things that are not preventable. You cannot prevent being a female, increasing age. So the older you grow, 2/3 of your breast cancers will occur when you're 55, age 50s and above. So increasing age you can't change, your sex you can't change. But obesity, being overweight, regular exercise is encouraged, eating healthy, avoiding smoking, avoiding alcohol intake. If you're doing that, stop. Avoiding a sedentary lifestyle, because the fat cells in our body get converted to estrogen, would put you at risk of getting breast cancer. So even after being treated for breast cancer, if you tend to then now get overweight or avoid a healthy lifestyle and exercise, you're putting yourself at risk of getting a recurrence of your breast cancer. So just living a healthy lifestyle, avoiding sedentary lifestyles, eating well, avoiding alcohol, avoiding cigarette smoking. For other things that you can't prevent is hormone replacement therapy. So multiple combined contraceptives. You can try other different forms of contraceptives. Getting pregnant early, if that is something you can choose to. Having children, breastfeeding them for longer. Continuous breastfeeding for more than a year has shown that it can reduce your chances of getting breast cancer. And if you do have a family history of breast cancer, if your mother, your sister, or your daughter got breast cancer, then doing self-breast examination monthly, going annually once a year for clinical breast examinations. And then if you're above 40, getting an annual mammogram in a place where you can get the radiologist to read your mammography and give you the results, or take it back to your medical doctor. Or if you're less than 40 and you have a risk, familial risk of getting breast cancer, then doing an ultrasound. There are other avenues where we consider MRI, but those are specific areas.
Amang'wele akobo breast cancer ak tetutik che imuche koib serianiton. Ongeten wikit nenyone ole king'olole ak Dr. Mwachiro akobo esophageal cancer en sait 1:30 nebo kemo.